Good morning to the press. Thanks for being here. Good morning, everybody. So, certain words have the power to make time stop. Malignant, aggressive, terminal, cancer. Like a spell, they still the air around us. Frozen in place, we feel the world we knew slipping away. And when the hands of the clock begin to move once again, we are not the person we once were, and it can feel like we're all alone. But with a patient navigator by your side, you're never alone. Navigators guide patients and their families through the complex and daunting world of cancer. They help patients with everything from scheduling appointments to keeping track of medications to coordinating things like transportation and childcare. When you have someone who knows the system by your side every step of the way, it changes everything. But for too long, these services weren't available to many Americans. That's because the proper billing codes didn't exist. And this meant that insurers couldn't pay for patient navigation services. So most medical practices couldn't provide them. So through the Biden Cancer Moonshot, Joe found a solution. His administration put in place new billing codes, ones that Medicare and other health insurers can use to pay for patient navigation services. But for those codes to help the most people, insurance companies need to use them, and that's where you all come in. So you step forward. Using these codes means that most of your members can benefit from the support of patient navigators. And that choice will change lives and save them. It's just not the right thing to do for patients. It's also the right thing to do for your businesses. So patients with navigators miss fewer appointments, are more likely to complete their treatment, and are less likely to need to go to an emergency room or be hospitalized. So on the behalf of the president and me, I want to thank you all. The companies that have stepped forward serve 150 million Americans, nearly half the country. And we know that those aren't just numbers. They're the father who will be able to enroll in a cutting-edge clinical trial because his navigator helped him find it. The student whose pain no longer keeps her from class because the navigator is helping her control the side effects of their treatment. The grandmother who can keep traveling and seeing her grandkids because a navigator helps her follow her treatment plan. Yes, the word cancer has the power to strike fear into our hearts. But as we've seen today, we have the power too. Together through the Biden Cancer Moonshot, we're building a world where our power is greater than ever before, where patients and their families have a trusted navigator by their side, where no person has to face cancer alone. And I can tell you from personal experience, it makes all the difference. So thank you. Danielle?
Yeah, thanks, Dr. Biden. I'm Danielle Carnival, Deputy Assistant to the President for the Cancer Moonshot. And when the President and First Lady reignited the Cancer Moonshot, it was to end cancer as we know it. That's to decrease the death rate from cancer by at least 50% over the next 25 years. That means saving 4 million Americans who would otherwise die from cancer between now and 2047. And to boost support, which is the topic that we're talking about today, for patients, families, and their caregivers. This means driving innovation to deliver new ways to prevent, detect, and treat cancer, but also making sure that the tools we have and those we develop along the way reach more Americans. So when the First Lady talks about this topic, she says it's going to take all of us. We are so excited that you represent that today. You are stepping up and taking action here. And so we want to hear from a couple of you. We're going to start with Dana Erickson, who's the CEO of Blue Cross Blue Shield of Minnesota.
Thank you, and thank you for the invitation. Very honored to be here, and it's been great actually just connecting with my colleagues around the country, so appreciate the opportunity. So I just reiterate, I'm honored to be here and to take this collective step forward with the Biden Cancer Moonshot. Ensuring pathways to cancer navigation services is a critically important step in overcoming barriers to essential medical care and improving overall health equity. As part of our mission to pave the way for everyone to achieve their healthiest lives, Blue Cross and Blue Shield of Minnesota is committed to providing access to medical care that is affordable, effective, and of the highest quality. I'm both humbled and excited by the opportunity to deepen our commitment to those facing cancer. In my previous career as a registered nurse, I saw firsthand how a cancer diagnosis is a life-changing event, an event that comes with fear about the future, but also about losing control. Even when someone we love is able to conquer cancer, the experience leaves a very long shadow, both for the patient and for their families. The emotional impact of a cancer diagnosis is compounded by the complexity of treatment. Having a dedicated person to help navigate the cancer journey, both in terms of coverage and treatment, can be life-changing as well. So I know all of us want to see the day where we can stand together and say that the fight against cancer has been won. Through initiatives like this one, we have an opportunity, though, to come together as a community and as an industry to focus on what is possible when we all work together. So thank you.
No, thank you.
Praveen Thadani, the President and CEO of Priority Health.
Very good afternoon, and thank you, Dr. Biden. Thank you, Dr. Carnival. It's a pleasure to be here. Priority Health is truly honored to be amongst the first health plans to support this navigation service, the Navigator, through the Cancer Moonshot program. We are privileged to serve about 15% of Michiganders, and when we think of health and well-being, we think about making healthcare simpler, exceptional from a quality perspective, equitable, and of course affordable as well. And I can state with a lot of confidence that Navigators will offer all these attributes. And I can speak from personal experience, having a father who just succumbed to cancer. It took me, my wife, my mom, and my sister as navigators as he was going through his cancer journey. I can speak from personal experience that when you suffer cancer, you're going through a range of emotions, as you articulated, beginning with fear and certainly anxiety, a feeling of loss, and feeling very overwhelmed as well. Treatment options can often be very confusing as well, and certainly as you think about then beginning the treatment, the side effects, and what happens after that, and certainly a lot of decision making that is needed as well. And again, we feel very strongly that navigators can help in all those respects. So oncology patient navigators have proven to be effective in improving participation in cancer screening, reducing time from screening to diagnosis, and from diagnosis to treatment initiation as well. Priority Health is committed to tracking associated health outcomes of patients who are benefiting from navigation services, such as care quality and experience measures. We also want to make sure that we help reduce cancer health disparities, and will continue advocating for the promotion of diversity in cancer training and workforce management, and of course the broadening of clinical trial participation to address the lack of racial and ethnic diversity as well. It truly is a pleasure to be here, and we are grateful for the support. Thank you.
We are grateful.
Thank you so much.
Thank you. We're going to turn to Dr. Kathy Moffitt, Senior Vice President, CVS Health, and Aetna Chief Medical Officer.
Good morning. I'm Kathy Moffitt. Thank you so much, Dr. Biden, Dr. Carnival, for allowing me to be here today. I am the Chief Medical Officer of Aetna, but I'm also a 6-year cancer survivor. And I'm so proud to stand, we're sitting, but to stand with so many people who have committed to enhancing navigation access as part of the Biden Cancer Moonshot. The Cancer Moonshot represents how powerful it can be when all the stakeholders in healthcare come together to improve the lives of people living with cancer. I can tell you from personal experience, a cancer diagnosis is a serious event, and it ripples through families and communities and support networks, and people facing cancer are often confused, and they're afraid and they're confused about the best course of treatment, and that's where the navigators can make such a difference. I'm proud of the work that we're doing at Aetna, not to support this, of course, and for the many ways that we are customizing the care experience for the members that are facing cancer that we serve, to make it personal, to make it accessible, to make it connected. And one of the most important things we plan to do is to share educational materials about this initiative with our providers and with the clinicians that serve our members facing cancer. So we are extremely grateful for this opportunity and grateful to participate in this with you. And we look forward to doing more of this work together.
Good. Thank you.
Thank you.
Thanks.
And finally, we have CC Connolly, President and CEO of Alliance of Community Health Plans.
First, Dr. Carnaval, Dr. Biden, thank you so much for this opportunity. It is really a great honor to be here with you and so many of these wonderful healthcare leaders to join in this very bold and inspiring cancer moonshot. We at the Alliance of Community Health Plans know that by collaborating with clinicians, patients, and others in the community, we can and will beat this devastating illness. It is a sad reality today that just about everyone has been touched, either directly or indirectly, by a cancer diagnosis. And we also all recognize that far too often the journey is a matter of unintelligible jargon and terrifying procedures. That is why I am so grateful to be here today also with 3 of our leaders from the Alliance of Community Health Plans, Praveen, who you've heard from, Dr. Charlie Bloom from HAP, and Dr. Heather O'Toole from Select Health. And they'll each be able to get into some of the specifics of their commitments to streamline care through navigation so that the course of treatment is just as easy as possible for patients and their caregivers. We at ACHP are pledging to educate all of our members on these new cancer navigation service codes, and we will be tracking the utilization of them so that you'll have some good information going forward. ACHP represents nonprofit regional health plans, approximately 22 million members in the United States. They have deep ties in their communities. They've been there on the ground for decades in close partnership with their neighbors and friends. And I would just say that for cancer patients and their loved ones who are faced with endless physical and emotional challenges throughout the cancer journey, the payer-provider partnership eliminates the hassles because they are all working together, allowing patients and their families to focus on what matters most, beating cancer. So we look forward to working with you, First Lady Biden, and our members, and the entire Cancer Moonshot team to end cancer as we know it.
Thank you. Thanks.
We're going to pause for just a minute. I know the press needs to depart and then we'll continue.
Thank
you,
you,
Chris.
Chris.
This way.